Hello, I'm Dr. Fox. Today, I'd like to talk about gestational diabetes. So first of all, what is gestational diabetes? Gestational diabetes, or GDM, is a type of diabetes which only affects women during pregnancy. It happens when your body does not produce enough insulin to make the right amount of glucose or sugar in your blood. Women with a higher risk of developing GDM are over 35, obese, pre-pregnancy BMI over 30. You also have a higher risk if there is diabetes in your family history, or you have already had GDM during a previous pregnancy, or a baby who weighed over 4,000 grams at birth. There is also an increased risk if you have had polycystic ovarian syndrome or have used corticosteroids during your pregnancy. More and more women have GDM. Currently, about 10% of women experience it during pregnancy. So is GDM dangerous? So my answer is that it is not dangerous if it is detected and treated, but you run several risks if it is not. Firstly, you are more likely to have a large baby. Also, there is a higher risk of birth complications and health risks like preeclampsia and shoulder dystocia for your baby. There is also increased risk of stillbirth in the final 4 weeks of pregnancy, and lastly, you are more likely to develop type 2 diabetes yourself in the future. So how do you know if you have GDM? You will be offered a blood glucose screening during your pregnancy. To have your blood glucose checked, you are given a sugary liquid to drink, and then an hour later, you have a blood test to check on your glucose levels. If they are high, you take a glucose tolerance test, drinking a glucose solution on an empty stomach, and your blood is tested 3 times before and after the intake. So what happens if you have GDM? GDM can be effectively treated, and most women with GDM go on to have a normal delivery and a healthy baby. Your healthcare provider will tell you how to make sure your glucose levels remain healthy, including eating a healthy diet, not gaining too much weight, getting enough exercise, and if necessary, taking medication to lower your blood sugar. Your healthcare provider will regularly measure your baby's weight and how much amniotic fluid there is in the womb. Also, you may advise to take another glucose tolerance test around 2 months after you have given birth to check for prediabetes and diabetes. In some cases, women with GDM are advised to give birth by induction at 38 to 40 weeks of pregnancy, and it is particularly important that women with GDM do their absolute best to breastfeed. Okay, thank you for watching. See you soon.